Welcome to the mini-series Biology of Meaning, Video 16. In our last years, we have learned that the model is exclusively biomedical. Many of our gene-ran interests and confusion include the biology of the sentido, BDS, the new German medicine, NMG, and the FARO model. This episode declares that it is one of a kind, it works, and it is integrated without being dogmas. ¿Qué la nueva medicina germánica, NMG? Proposed by Reich Geerdheimer, the NMG maintains that toda enfermedad comes with an unexpected biological conflict. The signal forms part of a special adaptation program. Existen dos fases el conflicto activo y la phase de reparación. The method of the NMG consists of the identification of the descending conflict, the localization of the organ involved, and the understanding of the biological phase. The therapy consists of resolving the conflict, supporting the repair process, and avoiding unnecessary interventions when the process is repaired. This propuesta in contemporary practice should be in dialogue with conventional medicine to avoid risks. What is biology of meaning BOM? The BOM amplifies its miracle of the new German medicine incorporating emotion, narrative, biographical memory, and symbolic significance. Authors as Enrique Corbera revealed this interpretative line. Aquí el síntoma no es solo biología adaptativa, sino expresión de una experiencia vivida. The method of the BDS consists of the indagation of the descending moment, the exploration of the associated emotion, the identification of repetitive patterns, and the rereading of the feeling of the syndrome. The terapeutica consists of the toma de conscience, a change of perception, and the integration emotional. FARO is neither a repetition of the BDS nor a repetition of the NMG. It is an integrative transdisciplinar model of health. Integrate the biological dimension sincerely, the deep psychological dimension, the energetic dimension, and the existential and evolving dimension. Dialogue with Carl Jung trabajando dark and archetypos, with Ken Wilber considering his model AQEL and including the levels of conscience, integrating the medicine traditional China with its necessary dynamic energy and the Taoism of medicine and philosophy apportando harmony and flow. FARO methods. FARO means full discernment of the symptoms in two levels. 1. Organic. 2. Emotionally conscious. 3. Unconscious symbolico. 4. Narrativo biográfico. 5. Energetico. 6. Contextual social. No cause unique. Busca coherencia sistémica. Therapia FARO. Clinical level. Rigorous biomedical evaluation. Interdisciplinary work. Energy level. Terrain regulation, inspired by traditional Chinese medicine. Conscious breathing. Regulating body practices. Psychic level. Shadow work. Integration of projections. Symbolic reframing. Consciousness level. Expansion of meaning. Narrative transformation. Evolutionary development. FARO in nursing and health professions. FARO enhances the clinical role by improving diagnostic listening, reducing over-intervention, decreasing iatrogenic communication, and promoting shared decision-making. In nursing especially, it integrates technical and symbolic care, expands clinical observation and evaluation, and humanizes healthcare. It does not replace medicine. It expands it. Training for professionals, coaches, and biotherapists. FARO training involves mastering a solid and comparative foundation in anatomy and physiology, acquiring a critical psychosomatic understanding, studying levels of consciousness and the AQEL model, possessing a clear and impeccable professional ethic, and recognizing well-defined limits of competence. Its objective is to avoid dangerous oversimplifications and irresponsible practices, as well as commercial practices lacking scientific evidence. Benefits of integration. It provides greater clinical discernment, less unnecessary medicalization, more conscious patients, less reactive professionals, greater therapeutic coherence. Final learning. NMG explains the biological program. BDS expands the emotional meaning. FARO integrates body, mind, energy, and consciousness within a responsible clinical framework. Evolution is not about denying the past. It's about integrating it with discernment. FARO quote, "True medicine doesn't fragment knowledge. It integrates it with awareness." Join the channel. Learn science with awareness because in health, knowledge is not neutral, it's vital.